We worked at Winn-Dixie together back in 2015, and that's how we met. And we've been together ever since. Been together almost 10 years this year, and married for 5.
Probably about 2 years ago, we wanted to start trying. Had 1 miscarriage.
We went to trying again after talking to my doctor, Dr. Holliday, and we were pregnant with Sutton.
Amber and I actually met when she was 17. I just started practice as faculty in 2013, and she was one of my first patients. We then started seeing each other at least once a year for our annual exams. I've been with her since she went to nursing school, and then when she became a nurse, working at USA as well, and when she got married, and when she became pregnant. It was great to see her make those steps on developing her family, her party of 3, and it also got to be quite real when, during her induction, things did not go to plan. So I was able to navigate the journey of 9 months, and it was really kind of boring, which is great. And it was very standard. There were no hiccups along the way. It really was textbook.
I don't really remember very much. I remember getting there and the nurse getting me ready, getting me in the bed, and getting me hooked up and all that.
The plan was to get induced that day, so we had packed everything up the night before. The morning of, everything was going good.
They wanted a very intimate delivery. She wanted it just her and her husband.
We all were there at the hospital with Amber for probably a good couple hours. And then we all dispersed and went our own way, but we had a group chat going on, getting updates on her from Isaac.
She was induced at 39 weeks pregnancy, and the induction went really well. However, around 9 p.m., we started to notice some changes to the baby's heart rate. And his heart rate started to have some dips, some decelerations, which were kind of concerning. And at the same time, we noticed that her blood pressure started to become very low. She was hypotensive, and it was something that was just a little bit unusual. So we gave her medicines for both the contractions causing potentially the fetal heart rate decelerations, as well as for the hypotension. But it didn't improve, and that was really unusual. Around 9:30, the heart rate of the baby actually dropped and stayed down, bradycardia, which was very, very concerning. And at that time, I looked at Amber and Isaac and I said, we have to do a section. We have to save the baby.
They wheeled her out into the hallway and threw me some scrubs. Told me to change, so I changed. And I don't even know how long it was. It could have been just 60 seconds that I was standing there. They wheeled her down the hallway, and then they walked me down the hall a little ways into a little room. It was right next to where she was.
And I pull my phone down and I'm looking, and it's Isaac, and it says emergency C-section. And then 1 minute later, he says, I need someone here now.
He was in like this recovery room off to the side from the OR. He was petrified.
We rallied the team. Everyone was amazing with trying to get to the OR quickly.
As we were rolling her to the OR after calling the stat C-section, she became somewhat altered and non-responsive with agonal breathing.
And she was turning a little bit blue. So when we got her on the bed, we looked and she was almost posturing where her back was a little bit arched and she was so rigid. And she was making this noise where she wasn't moving air. And at that time, we knew something had changed drastically. We quickly prepped to do the section and, getting things set up quickly.
It's kind of what we say controlled chaos. Everybody knows their role. It's a team effort when we're in the operating room between the anesthesiologist and the attending doctor.
She wasn't moving her air very well, so we had to intubate her.
The patient was already having a blood pressure that was not recordable, which is as a crisis of a situation as it could be.
We were able to then do this C-section very quickly. And then once we delivered the baby, Austin, the CRNA, called out and said, Amber doesn't have a pulse.
There was no signals on the pulse ox which tells us that there is a circulatory standstill. So at that point, we straight away had to call a code and get on top doing the chest compressions.
For about 7 minutes, we worked on her, which I think to a lot of people is a short time, but for the people where you know the patient, it's eternity. It's literally the 7 longest minutes.
The patient went into a ventricular fibrillation. We had to do 2 rounds of shocking, so we had a return of spontaneous circulation.
I was able to hear just about everything that was going on in there, which was really rough. It was around that time I started freaking out, and because I heard the defibrillators going off.
He was falling apart. He didn't know where or what was going on with the baby. He didn't know. All he knew was they did a C-section. He said, Mama, all I could hear was them pounding on her, and I could hear all the sounds coming out of the room because the operating room was right on the other side of the room where he was at.
And I got a call from Shay again saying something's going on. She coded. Everything went in slow motion. It was too much at the time.
If somebody doesn't have a heartbeat, they're not really bleeding because there's no heartbeat to pump the blood through. So she hadn't been bleeding from her open incision, but once she had returned, she had ROSC, she started bleeding, and she started bleeding a lot. Amber actually does meet the criteria for an amniotic fluid embolism. So an amniotic fluid embolism is a systemic collapse of all the organ systems, basically. There's cardiac arrest, respiratory failure. There's going to be this DIC, disseminated intravascular coagulopathy. The body's not able to clot. The blood previously that was coagulated and clotted off just starts running out of every single hole in her body. And then, especially in her case, she actually had a kidney injury, she had liver injury. All of her labs were not good. And it's this systemic shutdown of the body. We had to reset everything in the OR and then start closing everything. And she just kept bleeding, and she kept bleeding. So I looked at anesthesia and I said, she's going into DIC. We need to activate the massive transfusion protocol. And I remember thinking, she's got to get through it. She got through cardiac arrest. We have to get through this part. So a JADA is a device that was designed to help with postpartum hemorrhage. And so it goes inside of the uterus and it has this like vacuum suction to suck the uterus down onto it to help with tamponade, to help with bleeding. I inserted it and it did make a big difference. And we were able to get better control of the bleeding. But once I knew she had a heartbeat back, I knew we could do this. I knew that we were going to be able to save her. Sutton, his pH was rather low when he was born, and something that the NICU was concerned about was potentially for neurological damage on him. Babies that are born under the circumstances of an amniotic fluid embolism also have a high mortality rate. Those who do survive, about 50%, have neurological impairments as well. So NICU was definitely very concerned.
Me and my mom, her whole family, was in the chapel. We was waiting on Dr. Holliday to get done working on her, getting her stable enough to go to university.
And I just went through what happened. He didn't ask very many questions. He was just still absorbing it, and he was still in shock.
The main thing that sticks out was all the blood that she lost, and it was coming out of her gums, and it was just, I don't know, imagining that.
Her husband did ask that he could see her before we did the transfer, so we kind of cleaned up the OR, put a lot of blankets down, and had Isaac come and see Amber before we actually transferred her from our hospital. And that was the hardest part.
It was very hard, just because I know how she is, and she's always happy, and she was so excited. And just to see her laying on the table and then not know. It was just the thought of her not being here and then having to raise him by myself. I don't think that I could have done it, and I think the Lord knew that.
And then as we were wheeling her to the ambulance bay, her CW family was waiting outside the Peds ER. They said, "I love you." They said, "You've got this. You're so strong. You're a fighter."
I rode on the ambulance with her to University Hospital to the ICU. She was doing okay, but it's just the chances of someone coding again after they've coded is significantly higher than the average person having their initial code.
The main goal during my shift was to keep her sedated as possible because she was still hemorrhaging. She actually started waking up a little bit. I would say Amber, and she'd open her eyes and kind of look around. And this was like my whole 7 hours with her from midnight to 7 a.m. And I got back at 7 p.m. that night, and Amber was sitting up talking, holding hands with Isaac. She was still a little confused, but she was awake, alert, and I was just kind of like shocked.
The next thing I remember is probably my last day in the ICU. I don't remember being brought to University Hospital. I don't remember anything.
She was like waking up even after being without oxygen for that long. She recovered like a champ.
Amber was in women's complex for 2 to 3 days, and she was up and down a lot. She was doing so well moving. Her husband was with her the whole time. So there's lots of moving. It's unfortunate that is, because a C-section is a huge abdominal surgery. A lot of people don't quite have a grasp on that you go through all the muscles, you go through everything. So they're expected to be getting up and moving as much as possible.
The mortality rate for her particular type of amniotic fluid embolism was 43%. 85% of the survivors have neurological impairments. Meanwhile, Amber's just bounced right back and doing amazing. It's crazy to think of what could have been. Isaac could have been a single dad. He could have been doing this all by himself.
We are the referral center for the surrounding areas, so we see everything and we're prepared for everything. Our NICU takes care of the sickest babies and we take care of the sickest moms. Some people go their whole careers not seeing something like that. So to have been a part of it and to have a good outcome and to have been able to contribute to Amber's story is an honor.
It makes me feel very happy about what we did. I wish the mom and the baby the very best for the rest of their lives. Just a blessing that I could just be part of the care of a fellow human being.
This is definitely a journey that Amber and I are BFFs for life now, basically. Even though we'd always known each other for like 11 years, this is definitely a relationship that has changed and morphed. I think you have a very, very blessed little family that's going to go forward and just conquer everything that they've set out as a goal.
Now she gets to be the mama to my perfect little nephew, and my brother-in-law gets his wife, and I get my sister, and my dad gets his daughter.
They saved my daughter. They did. It took all of them to do what they did to save both of them.
Just thank you. Mainly thank you for, letting me have my family.
Thank you so very much for the care you gave me, not only me, but my family too, in such a hard time, and just making sure I was taken care of. If I would have been at any other hospital, definitely wouldn't be here.